The school that I was working for folded up.
I didn't do anything. I just stayed home. I wouldn't go anywhere.
The idea of being homeless was very scary.
I wasn't going to class. I left school early.
When I was in the street for a week, that's when I thought I've reached bottom.
45 years ago, there was the community of Sunset Park that was a new community that only had one doctor for 100,000 people. There were a lot of poor people. There was no such thing as Medicaid. There was no such thing as clinics back then. And the government, in this age of jobs being a big problem, racial tensions, and urban decay, decided let's try this idea of a community health center, letting the community heal itself, letting people describe what services their community needed, and let those health needs then be met through a community health center. When we had our first site at Sunset Terrace, that then grew into 9 primary care sites and 31 schools and 14 homeless sites that is now known as the Lutheran Family Health Centers network. We've grown to now be the primary care provider for 115,000 folks, providing 750,000 visits per year.
Sunset Park historically has been a kind of a cradle to new immigrants.
Lutheran Family Health Center served the Chinese, Arabic, Spanish, and Russian community for more than 45 years.
The concept behind the whole family health centers is to provide high-quality primary care to people who can't afford it.
If you have insurance, that's great. If you have public insurance, that's great. If you don't have insurance, there's a sliding scale, and if you can't afford the sliding scale, this place, like all other community health centers, is open and available to you in full.
We as providers get the opportunity to provide medical homes for our patients.
You have a one-on-one relationship with your doctor, but it's a proactive relationship where we reach out to you proactively and remind you about, based on your specific personal condition, all of the things that you need to do within that year to keep you healthy.
The dental department provides comprehensive care. That means that we don't do any outside referrals. So any specialty represented in dentistry, the patients can come and have that treatment here.
This community is like a Brooklyn Chinatown. So this health center is perfect for these patients who speak Chinese, and also our providers also speak Chinese.
We're the first institution to capitalize on distance learning and distance education.
Through our video teleconferencing program, we are able to place residents in some very rural, untouched communities, such as the far-reaching portions of Alaska.
Not only do we continue to grow as a direct healthcare provider, but we continue to grow as an educator. One of the ways we do this is now the health center is one of the A.T. Still University teaching campuses.
I chose the A.T. Still program here at the Lutheran Family Health Centers because it allowed me to really interact with the community at an earlier stage, which will be my second year of medical school. For example, as medical students, we follow the residents, and the program is structured in a way where we get the most education out of it by interacting directly, not only with the resident, but also with the physicians in charge of the patients. I felt I was in the right place when I was welcomed by the physician I was working with. And it was very rewarding to have him want us to be there and us to interact with the patients and really guide us throughout our second year.
The school that I was working for folded up. I couldn't find work. I tried to live off of my savings, and I wasn't able to do so. I had to give up my place where I was living. I moved in with some friends, and that didn't work out.
Some typical examples of our success are reaching out to folks that, some of them even homeless.
You know, you hear a lot of stories about homelessness and what happens when you're homeless. So with that, you know, being in mind, it was upsetting. And after being out in the street about a week, I decided to go into the shelter system. I always advocated for the people that were in the shelter. And Dr. Batcher must have noticed, and she wrote a proposal, and that's how I got the job.
So we helped Denise get her life back, and now she's giving back to the community.
Me being able to help those who are in a situation like myself, I mean, it's rewarding.
Some of our other success stories are like Devonnie, who was a disengaged youth. He'd lost his way, fell out of the norm for kids, dropped out of school.
I got bullied in school, and I was very distracted in school, and I was going to school for all the wrong reasons. They actually came to me and they talked to me about my problems. You know, they told me that I could come to them anytime I want, if I'm having a problem at home or if I need help with something.
We were able to intervene with him through our Project Reach Youth, help him get his GED, go on to then get a job.
In 5 years, I can see myself working at Lutheran as a paramedic or a nurse.
Lutheran took a chance on a 20-year-old single mother with no experience and gave me an opportunity to get a job. And with that, I was able to raise my son, to have the opportunities that I didn't have, not be on welfare. Everyone has the same goal. You want to raise your family, you want to live happy, and you just want to have a life. And I think that when people start talking to one another, they see that no matter where you come from, everyone has the same focus.
It's remembering some of the things that we went through when we grew up in neighborhoods. Like for me particularly, I grew up in a very similar neighborhood. It's about being able to give back.
If Lutheran Family Health Center was not here, I would not get the experience as far as the community-based program that no other place would offer that.
The people who live here are vibrant, they're hardworking, they love their children. If that vibrancy of each community within New York is fostered and developed and nurtured, then New York as a city becomes a vibrant and sustainable entity.
If it wasn't for Lutheran, the homeless community, let me be specific, because that's what I know about, would be lost.
It's that one-on-one caring for people that happens day in and day out that make our mission come true.
They told me that I could do it, you know, that I could make something out of myself.
When I come here, I see the sister with her sister. I see the mother with her child. So it's that human connection that you never want to lose. That real reaching out and someone reaches back.